back to my channel. My name is Jacqueline, and I have a very special guest with me today, Dr. Beck.
Hello everybody, I'm Dr. Joel Beck, and I've been in practice for 15 years now, and it's a pleasure being here with Jacqueline and Kevin, and I'm here to answer questions and to hopefully help to educate the people out there watching this, and to assist in any type of transition that you may be interested in.
He's the surgeon who's done all of my skin removal surgeries, so I'm so happy he's sitting down with me and we're going to answer some questions for you guys. I know I get a lot of questions about skin removal, so I thought this would be kind of something fun to do together. So we're going to answer, or he's going to answer some questions, and he's going to kind of guess what the answer would be or how I would answer it. So this is more just specific to like my surgery and our relationship and what we've been through on this journey. So he's amazing, first of all, so we'll start with that. So we'll get right into the questions, and then you'll just answer how you think I would answer, what you think I would say for it, okay? So the first question is, out of all of the procedures I have had done, which one do you think was the most difficult for me to recover from?
I would think the upper body lift would be the most difficult one so far. Yeah.
Yeah, I think that one was a really hard one because it was back and arms.
Yeah, the upper body
was the hardest one.
Yeah, the upper body lift is it's one of the procedures in the continuum of multiple body contouring procedures for a massive weight loss patient that works at removing the skin to the upper arms, the bat wings. It also helps to remove a lot of the extra skin to the back. And when you do a lower body lift, the next phase is often to do an upper body lift, which will help assist in you being able to appreciate all the changes that were made to your tummy. So
yes, definitely. Okay, so the second question is, which procedure do you think I was or I am most excited to have done, or where I wanted to
I know the answer to this one. Well, I think that one of the ones that's probably the most difficult to recover from, and the one that is almost often the most dreaded one, would be the medial thigh lift. Is that the one you're thinking of?
Yes. I'm most excited for that, but I know it's probably going to be the hardest recovery.
Yeah. So it's that procedure actually is to remove a lot of the extra skin and fat to the inner thigh, especially when you've lost all this weight and you can't improve your lower extremities anymore because you just have all this skin. And so what we've had to do so far has been to liposuction the area to debulk all of that fat, so that way we have a better chance of improving your contour and making it tighter and making the skin and your thigh look thinner.
Mm-hmm.
Yeah.
Yeah, I'm definitely most excited about that one. So number 3, since you haven't gone through any of these procedures, which one would you have thought or think would be the most painful?
So Jacqueline and I, we've been through a lot together so far. And one of the procedures we did was called a corset trunkplasty, where we literally removed pretty much almost all of her skin to her abdomen. And that was to remove the excess skin falling down. It was to remove not just the skin in the vertical fashion, but also in the horizontal fashion. So that was a big procedure to get through. After that, we then transitioned to doing an upper body lift, where we removed the skin, as I mentioned before, from the arms and the upper back regions. We've also did a revision on that. And next, we worked on liposuction to the lower extremities for debulking purposes. That means removing the excess fat so we have just more skin to be able to work with and fighting with all the fat as well. Of all those, what would be the most painful? I still would say probably the upper body lift.
Yeah, I think so. I think the arms was really hard because you couldn't do anything yourself either.
Yeah.
So you had to have someone like feed you, help you go to the bathroom, on top of it already being painful, and then to even put your arms down hurt because of the incision that went all the way around. So That definitely was the most painful so far. Good job.
And I also think that, removing all the skin from the arms, as you said, it's an inconvenient thing where you can't really utilize your arms the way that you need to for just the standard activities of daily living,
Right.
meaning, going to the bathroom, putting your clothes on, brushing your hair, reaching to a cabinet to get something out of the cabinet. So you don't realize how much energy it takes and how much dexterity and it takes to do all those things until you actually are, recovering.
Yeah, and I think Kevin got pretty good at doing ponytails to help me because I couldn't do anything. So he's a champ with that.
Yeah.
So, number 4. On the day of surgery, could you gauge how I was feeling? If I was feeling nervous, anxious, excited? How did I seem to you?
I think you were a little bit of everything. I think that you were really excited, but of course it's very scary to undergo some of these operations. And these are big operations to go through that take a lot of time and energy to actually perform. So I think that it's very common for you or anybody else going through this, these procedures to feel anxious and scared, but yet excited. And really what you need to focus on is not the immediate post-op recovery, but where you're going to be 3 months, 6 months down the line. Because as you see from all the posts that Jacqueline's made, she's getting back into working out and she's keeping her motivation and she's owning it. And that's what it takes for somebody to really succeed in a total body transformation.
Definitely. I definitely agree with that. It's hard in the moment, but you have to focus on what the results are going to be after that because it's not going to be painful like that forever.
Yes.
So, number 5, when I came in for my first consultation to see you when I was still overweight and had a lot to lose, did you ever think I would be back to see you after I lost all that weight and that we'd be doing these surgeries?
I think that there is something about you that makes you special. I think the fact that you're able to lose 350 pounds with sheer will and motivation and is something real, and that's what it takes to be successful in not just weight loss, but in everything. So I wasn't surprised.
Good.
Yeah.
I wasn't either. I knew I'd be back to see you. Did you know, now this is just, you can kind of guess if you know this answer, but do you know what the moment was when I definitely knew I made the right choice in picking you for my surgeon? Like, there's one moment specifically. I don't know if you remember.
I'm not sure if I remember.
I don't think you will, because it's part of the way you are. It's just like your bedside manner, just the way that you conduct yourself as a doctor and as a surgeon, I think is...
I think that one thing that I do try to do, and this is for everybody I see all the time, is I try to focus first off on being a real human being and leveling with each of my patients, including you. And I don't ever try to talk down to people. I try to listen to the issues at hand and try to come up with real solutions. And I don't know, maybe that is part of the moment that you're thinking.
So it's definitely from like the moment I met you, like I think that's important. You have to have a connection with the surgeon or the doctor who's going to be helping you go through all these. I think that's really important. And I definitely felt that with you right away, like that connection that you were going to take care of me. You not only had great results that you've done in the past, but just like that bedside manner of like you were going to actually take care of me. But there's one specific moment I want to share with you. I don't know if I ever told you.
This is interesting. This is exciting.
But it was for my very first surgery, and I was getting wheeled back into the operating room. And I remember I got on the table, and I was kind of waiting there, and we were waiting for like the compression socks to come on before I like fell asleep. And I remember I started getting really nervous, and I think you could tell, and you were like getting everything ready, and you came over to me, and you just held my hand. And you kept talking, doing what you were going to do, and then I just fell asleep with you holding my hand, and that was like a big moment for me. Like I knew you were going to take good care of me.
That's a big moment to hear.
Yeah.
That's a very nice thing to hear. And one of the reasons why we become doctors. One of the reasons why I wanted to be a surgeon is that I can make a big difference in your life. And I think that it's not too often we get something, a doctor gets what Jacqueline just said, to be able to hold on to, because that will keep me going for a long time.
Yeah.
So
and
thank
it's
you.
after every during every surgery, you've done the same thing, but that one moment, it was like I could like breathe because I knew like you were gonna take care of me.
That was
so.
sweet.
Yeah.
Thank you. Thank
I know.
you.
I've been wanting to tell you, but. So that is all the questions for this video. I hope you guys enjoyed it. I hope you learned some more information about skin removal, a little bit more about Dr. Beck. If you have any other questions, please feel free to leave it in the comments down below. Make sure you give this video a thumbs up, especially if you want to see more videos with this guy. And make sure you subscribe as well so you don't miss any more videos. So I hope you guys are all having a great day, and we'll talk to you very soon. Bye.
Thank you. Thank you for the time. Thank you, Jen.
Yeah,
Thank
thank
you,
you.
Jen.